Good day. We're still busy with the Mother Baby Friendly Initiative. I'm still Anna Nolte. We're still busy with lesson 1. And with the part that we are going to do now is part 3, which is about the engaged in antenatal conversation about breastfeeding. And we're specifically going to concentrate about what we need to tell the mother about breastfeeding during the antenatal period. Now, we have done in the very first part of lesson 1, we have talked about the antenatal care, and we have talked about the fact that we need to discuss the importance of breastfeeding with mothers and babies during the antenatal period, because this is when they need to take their decision and when they need to gather as much as possible information about the method of feeding, the way that they are going to feed their baby. So we need to prepare them for breastfeeding and give them as much as possible knowledge regarding breastfeeding. Now, just a little bit of, this is a very full slide. It comes from the Department of Health's description of the different steps, the 10 steps for successful breastfeeding. And the aim of the antenatal information is to empower pregnant women, mothers and their families on basic information about breastfeeding to make an informed infant feeding decision. So that's our main aim. And then the rationale is all pregnant women must have basic information about breastfeeding in order to make informed decisions. Now, I'm not going to go through the different implementation standards. This is that one should, in whatever conversation you have with the mother, that should be given breastfeeding information, and usually start with the first and the second antenatal visits and how one should spread it over the different antenatal visits, etc. I've only highlighted one aspect here, and that's that the antenatal discussion of breastfeeding should include at minimum the topics outlined in the antenatal checklist. And when we look at the antenatal checklist, we see here the things that we really need to discuss with the mother during the antenatal period. The early initiation of breastfeeding, the exclusive breastfeeding under 6 months, continued breastfeeding for a year, introduction of semi-solids, minimum dietary diversity, meal frequency, minimum acceptable diet, consumption of iron-rich and iron-fortified foods. I'm going to concentrate to a large extent today on the advantages, the benefits of breastfeeding, because I think this is not on this list, but I think it's one of the most important things to tell the mother in the antenatal period when we try to help the mother or to give the mother the sufficient knowledge in order for her to make a informed decision. I think we can only decide and make decisions about anything in our lives if we know the benefits of that specific thing as well as the disadvantages. And that's what we're supposed to tell mothers during the antenatal period. Now, as we're saying here and as we've said before, deciding on how to feed the new baby is a major decision for the mother. And that can be influenced by many different events and experiences in the mother's life. It's been affected by her relationship with her own mother, by relationship with other family members, pressure from other family members, her own identification with her own sexuality, etc. So there's a lot of factors that play a role in the decision of whether the mother is going to breastfeed or not. So it's therefore, as we're saying here, very important that mothers have the opportunity to discuss the various options so that they can make the best possible informed decision and base their decision on facts that they get from a knowledgeable person instead than just hearsay from other people. Now, as I've said, I'm going to focus mostly on the advantages of breastfeeding, the benefits of breastfeeding. Now here we differentiate between the advantages of the baby having breast milk, and then on the next slide we will see the advantages of giving breastfeeding, of breastfeeding as such. Now the advantages of breast milk is that it contains the correct nutrients that the baby needs, and it's easily digested and efficiently used by the baby's body, and we will come to this in more detail. It protects the baby against infection. We will also discuss that in a little bit more detail, and it provides long-term protection against chronic non-communicable diseases such as obesity, hypertension, and diabetes. Okay, and if we then look at specifically the advantages of breastfeeding, we say it's cost less than artificial feeding. It helps the mother and the baby to bond, and that is develop a close, loving relationship between the mother and the baby. It helps a baby's development. It can help to delay a new pregnancy because of the physiology and the delay in ovulation. It protects the mother's health. It helps the uterus to return to its previous size quicker, so it helps with involution and reduce bleeding much better, and it also reduces the risk of ovarian cancer and breast cancer in the mother. Okay, one of the biggest benefits or advantages of breast milk is the nutrients in breast milk that are being perfect for a baby. The producers of formula milks try their very best to imitate the breast milk as much as they possibly can. But we will still see when we go through this that there are some differences that make breast milk still the best. Now, many of the formula milks are being made from a variety of products, namely animal milks, soybean and vegetable oils, and then being adjusted so that they are very much like human milk. But still, they are not perfect, and I will try and show you why not. Now, we need to understand also the differences between animal milk and human milk to understand to a very large extent the differences between human milk and formula milk. Now, all the milks, whether they are breast milk or formula milks, contain fat, certain amounts of fat, which provides energy, certain amounts and types of protein for growth, and a milk sugar called lactose, which also provides energy. Now let's look at what's the difference between the amount of protein in human milk and the amount in animal milks. Now here you can see in this diagram here, on the left side here is human milk, then we have cow's milk and goat's milk. And if we look at the protein part here, we see that there is a much bigger proportion of protein in the cow's milk than in human milk, as well as in there's also a large part of protein in goat's milk. And it's very difficult for the baby's immature kidneys to excrete the extra waste that comes from this extra protein. Then if we look at the fat content, human milk contains essential fatty acids. That's very essential and important for the baby's brain to grow, as well as for his eyes and the development of healthy blood vessels. And these fatty acids are not present in cow's milk and other animals' milk. And they may have been added to a certain extent in formula milk, but only in some of the formula milks. Now, if we further continue to look at the differences in human milk and cow's milk, and this specifically now here, looking at the protein content between cow's milk and human milk, we have seen that there's much more protein in cow's milk than in human milk. But if we look at the different types of protein, we will see that there is a large quantity, this is human milk here, a much larger part of the human milk is being made of or exist out of the whey part of proteins, while a much bigger part in the cow's milk is being made up by the casein part. And this casein part forms thick, indigestible curds in the baby's stomach, which make cow's milk then much more indigestible to the baby. While the whey proteins contain anti-infective proteins, which helps to a large extent by protecting the baby against infection. Now, also, artificially fed babies might develop an intolerance to protein because of this composition of protein in cow's milk, and that might lead to the development of diarrhea, abdominal pain, rashes, and other symptoms. Now, the other very important benefit of breastfeeding is protection against infection. And to me personally, I think that's the biggest and most important aspect or benefit of breastfeeding. Because as we've seen now with the proteins and etc., the manufacturers of formulas try to imitate breast milk as best as possible they can. But this part of breast milk, they can't really imitate. And as I'm saying, that to me is the most important benefit of breastfeeding. Now, breast milk contains white blood cells, and we know that white blood cells play a very important role in protection against infection and also the fighting of infection. And it also contains a number of anti-infective factors which help to protect the baby against many of the infections. Breastfeeding specifically protects babies against diarrhea and respiratory illnesses, especially in early life when these infections are very important. Also, ear infections, meningitis, and urinary tract infections. Breast milk also contains antibodies against certain infections that the mother had in the past, so the baby will be then being protected against those conditions. So it's very important also that the baby should not be separated from the mother when she has an infection, because instead of the infection being carried over to him, he will rather be protected against the infection, because in the breast milk there will be antibodies against the specific infection. Now, if we look further at the differences between colostrum and mature milk, we will also see some of the benefits of giving the baby colostrum, but also the benefits of giving the baby mature milk. Now, the composition change from colostrum to mature milk, and as the baby gets older, the composition changes. And then in mature milk, we also distinguish between fore milk and hind milk, which we will do just now. So if we look at colostrum specifically, it's the breast milk that women produce in the first few days after the delivery of the baby. And it's usually a thick and yellowish color, or it can be clear, but it's mostly thick and yellowish. And it contains much more protein, and here you can see the difference in the protein content between colostrum and mature milk. And then over a few days, 3 to 4 days, gradually the colostrum changes into mature milk, and with a composition of mature milk, as you can see there. Now, other differences between colostrum and mature milk is that colostrum contains more antibodies and other infective proteins than mature milk. And this is a part, and this is very important, this is the part of the reason why colostrum contains more protein than mature milk, because many of these antibodies and anti-infective proteins are then in the protein part of the colostrum. The colostrum also contains more white blood cells than mature milk. So in total, colostrum helps to prevent the baby against bacterial infections. And this is very important. I'm always saying to mothers, if they can't breastfeed, if they can only at least give babies have the benefit of having colostrum, they already gained a lot. Colostrum also have a purgative effect, which helps to clear the baby's gut of the meconium, the first dark stools. And this also clears the bilirubin from the gut, and it helps to prevent the formation of physiological jaundice during the first few days of the baby. Further, the differences between colostrum and mature milk is there's also growth factors in the colostrum that helps the baby's immature intestine to develop after birth. So it helps to prevent the baby from developing allergies and intolerance to other foods because of the better, I almost want to say, maturity of the intestines. Colostrum is also very rich in vitamin A, which helps to reduce the severity of any infections. We all know that vitamin A has an antioxidant kind of effect, and that's what helps to prevent the baby from getting infection. It's also very important for the baby to have colostrum for the first few feeds, and that we have seen now with what all the advantages of colostrum should be. So the baby should not be given any other foods or drinks before they start with breastfeeding, because that might make that they don't want to take the colostrum, and that also make that they don't take enough of the colostrum. So first of all, the first feed that baby should preferably receive is colostrum. Artificial feeds, but that's been given to the baby before colostrum, is also likely to cause allergy and infection because the baby has not gained all these benefits from the colostrum as we've seen here. Then if we look at the differences between fore and hind milk, now I'm teaching you much more information here than what one would give to the mother during the antenatal period. One, like we've said in the previous part of the lesson where we have done the different communication skills, we've said that it's important to give the mother very simple information and not too much information at once. So we obviously need to determine how we will tell this mother or give the mother this information in a very simple way so that she understands what we are saying. So if we look at the differences between fore and hind milk, it's also very important, and we will come back to this when we do the physiological aspects around breastfeeding again. Now, fore milk is the milk that is being stored in the sinuses, which we will see again when we do the anatomy of the breast. And this is usually the thinner milk that the baby starts drinking. So the moment that the baby starts breastfeeding, starts drinking on the breast, she will get the fore milk, and then after a while, more milk is being produced by the alveoli in the breast, and more hind milk is being formed. Now, if we look at fore milk, is a thinner milk and it looks more watery, while hind milk is a whiter milk. Now, if we look at the composition of fore milk and hind milk here, we see that it's more or less similar in protein content, and it's more or less similar in lactose content. But what differs is the fat content. Hind milk has a much higher fat content than the fore milk, and that's usually what keeps babies satisfied between feeds. So it is very important that the baby should receive both hind milk as fore milk, because hind milk is usually not only making the baby fuller, but it also provides much of the energy of a breastfeeding. Now, mothers might worry, and that's also one of the aspects that we need to teach mothers on, that their milk is too thin. But milk is never too thin. It's just a difference between fore milk that looks a little bit more watery and hind milk that looks more whiter. The fore milk, as we've said, have a bigger water component than the hind milk. Now, if we look at the risk of diarrhea by feeding methods, this chart shows research and the findings of research that has been done in the Philippines. And what you can see here is this little diarrhea that was present when babies were exclusively breastfed in comparison with this, where the baby was exclusively artificially fed. So we can see that there's a much higher incidence of diarrhea in bottle-fed babies than in breastfeeding babies. And this is due to several factors. It might be due to, like we've said, the protein content that's much more indigestible for babies of formula feeds, but it might also be because of hygiene and that the milk got contaminated with bacteria, etc. Now, artificially fed babies get diarrhea much more often than breastfeeding babies, as we've said just now. And one of the big factors here is also because of the anti-infective factors that's present in breast milk, and obviously preventing the baby or protecting the baby from the diarrhea. And also, as we've said, the artificial feeds might be contaminated, and breast milk is never contaminated. Breastfeeding, as we've said previously, also protects the baby against respiratory illnesses, and the mortality from pneumonia is increased in babies who are not exclusively breastfed because of this. And as we've said previously, breastfeeding also protects the baby against the development of other infections. Then if we look at the psychological effect of and benefits of breastfeeding, we see that the close contact from between the baby and the mother helps definitely to form an emotional bond between the mother and the baby. Babies tend also to cry less if they're breastfed, because they feel a little bit more emotionally secure. And that doesn't say, and when one educates the mothers on these facts, one should be very careful that we're not overemphasizing the emotional bond of breastfeeding. It doesn't say that mothers who are supplementary feeding or have to feed their babies, for example, if breastfeeding, they fail in breastfeeding, that they can't have a similar very well developed emotional bond with their babies. So one must be just careful on how you are conveying this message on emotional bonding. Then there are also some studies that has shown that babies who are breastfeeding, receiving breast milk, develop intellectually better than babies who are not receiving breast milk. There's not a lot of evidence on this. It looks and it seems as if they develop intellectually better, specifically in low birth weight babies who were fed breast milk in the first weeks of life seem to perform better on intelligence tests than babies who received artificially foods. Now, the risk of artificially feeds, it may interfere with bonding, but as we've said, mothers who are giving artificial food feeds can bond and have an emotional bond with their babies, as well as mothers who are breastfeeding. Artificially fed babies are more likely to develop diarrhea and other diseases, as we've said. They might get too little milk and become malnourished, but also might get too much milk and become obese very quickly. The baby is more likely to suffer from vitamin A deficiency. That's also one of the things that the formula manufacturers of formula feeds try to imitate as best as possible in producing their milks, but this is one of the places or one of the things that they are still lacking to a certain extent. Babies that's been bottle fed are more likely to develop allergies like eczema and asthma possible, and the baby might become intolerant of animal milk, and this causes diarrhea and rashes and other allergy symptoms. It can also, there's a higher risk of developing of some chronic diseases in children who receive artificially foods, like, for example, diabetes, etc. And a baby might get too much artificial food, like we've said earlier, and become obese. And that brings us to the end of lesson 1. So you have to now complete your quiz so that you can continue to lesson 2.